Do you know that over 800,000 people experience a stroke in the U.S. alone each year? That's a devastating reality that underscores the pressing need for everyone to understand the potential warning signs that precede a stroke. What's even more concerning is that about half of all strokes go unnoticed, leaving individuals vulnerable to its devastating effects. Fortunately, awareness is the first step towards prevention. As they say, forewarned is forearmed. In this video, we will discuss 10 symptoms that may appear 1 month before a stroke, helping you to spot the warning signs and take immediate action. Early detection and treatment are key to minimizing the damage caused by a stroke. So let's dive into the science behind these indicators. Symptom number 1: trouble sleeping. Sleep plays a vital role in overall health, and certain sleep disturbances may signal an increased risk of stroke. Research has shown that both insomnia, the inability to sleep, and hypersomnia, the tendency to sleep excessively, can be associated with a higher risk of stroke. For example, studies have linked chronic insomnia to a significantly elevated risk of both ischemic stroke and hemorrhagic stroke. The exact mechanisms by which insomnia contributes to stroke risk remain incompletely understood, but several theories exist. One hypothesis suggests that the chronic physiological activation and heightened stress associated with insomnia may lead to sustained elevations in blood pressure, a major risk factor for stroke. Additionally, sleep deprivation can cause alterations in hormone levels, including those involved in blood clotting and inflammation, further increasing stroke risk. On the other hand, hypersomnia or excessive daytime sleepiness is also believed to be linked to stroke risk. This could be due to underlying sleep disorders that disrupt normal sleep patterns and reduce the body's oxygen levels, potentially damaging blood vessels and increasing the likelihood of stroke. Notably, research has consistently demonstrated that individuals who experience more than 2 or 3 naps per week have an elevated risk of stroke. Recognizing unusual sleep patterns as a potential red flag is a step toward prioritizing your health. By seeking professional guidance, you can manage sleep disorders effectively, reduce stroke risk, and improve overall well-being. Symptom number 2: extreme tiredness. Persistent feelings of tiredness, exhaustion, or fatigue that is not alleviated by rest could be a crucial warning sign of an impending stroke. While fatigue is a common human experience, especially after physical exertion or periods of high stress, constant exhaustion may signal underlying health issues. Research indicates a link between extreme fatigue and an increased risk of stroke. Several factors may contribute to this association. First, a stroke can result in reduced blood flow to the brain, leading to reduced oxygen supply, which in turn can cause persistent fatigue. Furthermore, the recovery process following a stroke can be arduous, resulting in significant fatigue. Studies have explored the relationship between fatigue and stroke risk, demonstrating that individuals experiencing unexplained excessive fatigue have an elevated risk of stroke. Moreover, fatigue has been identified as a predictor of poor outcomes in stroke survivors. Addressing fatigue as a standalone issue is not only beneficial for overall health, but may also play a proactive role in reducing stroke risk. Lifestyle modifications such as regular exercise, adequate sleep, and stress management can help combat fatigue. Consulting healthcare professionals to rule out underlying medical conditions and to develop personalized strategies for fatigue management is recommended. Symptom number 3: sudden, severe headaches. A sudden, severe headache that is different from usual migraines or other types of headaches can be a serious warning sign of an impending stroke. This kind of headache often feels intense and comes on suddenly. It's essential to differentiate this symptom from regular tension or migraine headaches. A study published in the Journal of Neurology, Neurosurgery, and Psychiatry reported that about 20% of patients who experienced a warning headache before a stroke described the headache as the worst headache of my life. The study emphasized that such severe headaches are more common before a hemorrhagic stroke than an ischemic stroke. Another study in the Annals of Neurology found that about 20% of patients had a new or unusually severe headache shortly before a stroke. While not all severe headaches indicate an imminent stroke, they should never be ignored, especially when accompanied by other warning signs. Seeking immediate medical attention is advised. Symptom number 4, blurred vision. Blurred vision or other visual disturbances can be an early warning sign of an impending stroke. This is because visual problems can indicate circulatory issues in the brain, specifically reduced blood flow to the part of the brain responsible for vision processing. One study, for instance, reported that nearly 60% of patients who experienced visual symptoms prior to a stroke had an ischemic stroke. There are various types of visual problems that can serve as warning signs. These include double vision, seeing spots or floaters, loss of peripheral vision, or sudden changes in how things look. These symptoms often arise from a decrease in blood flow to the optic nerve, which connects the brain to the eyes. Upon noticing these signs, immediate consultation with an eye specialist or neurologist is recommended. Symptom number 5, changes in urination. Changes in urination can be a subtle yet significant indicator of a potential stroke. These changes may include increased frequency, particularly at night, and a strong urge to urinate immediately. The National Institute of Neurological Disorders and Stroke conducted a study that found specific urinary symptoms could predict stroke risk. These symptoms included waking up 2 or more times at night to urinate, straining to empty the bladder, and experiencing a sudden urge to urinate with little warning. According to experts, these symptoms might indicate underlying vascular issues. The exact connection between urination changes and stroke remains unclear, but the observed correlation is significant. It's crucial to address these changes promptly, not just for stroke prevention, but also for overall health. Symptom number 6, arm or leg weakness. Weakness or numbness in the arms or legs, often on one side of the body, is a hallmark symptom of an impending stroke. Known as hemiparesis when it affects one side of the body, this symptom usually manifests as a loss of muscle function. In contrast to general muscle weakness, which can result from overuse or fatigue. Stroke-related muscle weakness is often sudden and accompanied by other neurological signs. A study from the American Heart Association reported that around 66% of individuals who had a stroke initially experienced weakness or numbness. Specifically, weakness in the face, arm, or leg, especially on one side of the body, is a crucial warning sign that demands immediate medical attention. Symptom number 7, difficulty speaking. Problems with speaking or understanding language can be a serious sign of an impending stroke. This symptom, known as aphasia, can manifest as an inability to articulate words, form coherent sentences, or comprehend spoken or written language. One study highlighted that approximately 30% of stroke survivors experience aphasia following a stroke. Various factors may contribute to this symptom. Reduced blood flow to parts of the brain responsible for language functions can cause aphasia. Interestingly, the study also noted that although aphasia is often associated with left-sided strokes, it can occur with right-sided strokes as well. However, right-sided strokes are more likely to affect spatial awareness and neglect one side of the body rather than language abilities. If you or someone you know encounters any difficulties with speaking or understanding language, it's vital to seek medical assistance without delay. Now that you're well versed in some of the more common warning signs, it's time to shift focus to symptoms that often fly under the radar. These lesser-known signs can be equally vital in recognizing when a stroke is imminent. Stay vigilant as we reveal symptoms that could save a life. Ladder number 8. Dizziness and loss of balance. A sudden episode of intense dizziness or vertigo and a feeling of losing balance are considered warning signs of an impending stroke. Dizziness can result from reduced blood flow to parts of the brain responsible for balance control. This symptom often occurs in association with other neurological issues. According to a study by the American Stroke Association, roughly 20% of individuals who experience dizziness or unsteadiness later have a stroke. These symptoms can manifest as a spinning sensation, lightheadedness, or a feeling of impending loss of balance. If accompanied by other neurological signs, such as weakness or vision changes, it's crucial to seek immediate medical care. Symptom number 9. Nausea and vomiting. Nausea and vomiting can be less common, yet still significant warning signs of an impending stroke. While these symptoms don't directly indicate a stroke, they often accompany neurological conditions that warrant attention. According to a study in the journal Neurology, nausea and vomiting occurred in about 15% of patients prior to a stroke. These symptoms might result from disruptions in blood flow to the brainstem, which controls vital functions like vomiting. Nausea and vomiting, when coupled with other neurological warning signs, should prompt a prompt medical evaluation. Symptom number 10. Tingling or burning sensations. Unusual sensations like tingling or burning on one side of the body, particularly the face, arm, or leg, can signal an impending stroke. Known as paresthesia, these symptoms result from abnormal neurological signals. Approximately 15% of patients experience these symptoms before a stroke. Paresthesia can be subtle and easily dismissed, but they shouldn't be ignored, especially when accompanied by other warning signs. Seeking medical advice is advisable to rule out potential underlying issues. Recognizing the early warning signs of a stroke is crucial for timely intervention. Sharing this information can help save lives. Now that you're equipped with these vital insights, we encourage you to take immediate action by sharing this video with friends, family, and loved ones. Together, we can prioritize health, mitigate risks, and foster a safer environment for everyone. If you found this video informative and want to learn more about stroke prevention and health, subscribe to our channel and stay updated with our latest posts. Thank you for watching, and here's to your good health and well-being.